Hello everyone, this is Mr. Matus and I'm here today to discuss with you the endocrine system, which is one of the most complicated systems in the body. So what I will be discussing will be the anatomy of the endocrine system, the glands and the hormones that they secrete, and also the functions of the hormones. So you have to take note that if you know the functions of the hormones, you will also be able to know the associated problems if there is a problem with the gland. So that's really very important because in the NCLEX, it's really very hard to memorize the symptoms of the disorders. But if you understand the anatomy and physiology of the endocrine system, it is really very easy for you to analyze and remember the symptoms of disease conditions as well as the associated nursing interventions. So let's proceed and discuss this very important topic. So this is just an overview of the endocrine system and the related structures. So as you can see, we have the picture that depicts or illustrates the endocrine glands found in the male and the female. So you can see here that in the brain you have the pituitary gland and also the pineal gland. And somewhere also over here you can find the hypothalamus. Now you have to remember that the hypothalamus has a very important function. It is actually the one that regulates the pituitary gland also to release the hormones. So meaning to say that if you have damage to the hypothalamus, that will also affect the function of the pituitary gland. Now on the neck area you could find the thyroid gland, and also you have to remember that around or adjacent your thyroid gland would be your parathyroid gland. Now here on the chest area you could find the thymus gland, and here above the kidney you could also find the adrenal gland, or the other name for that is your suprarenal gland. And also here your pancreas. So your pancreas is an endocrine gland, but you also have to remember that the pancreas is also involved in the digestive process. So the pancreas is actually both an endocrine gland and an exocrine gland because it secretes hormones, and at the same time it also secretes your different enzymes for digestion. Now you also have here your ovaries for the female and also the testes for the male, which secrete your hormones that are really very important to promote reproduction and also to maintain or develop the secondary sexual characteristics. So let's discuss the endocrine system, the different glands, and the hormones that they secrete, and what are the functions of those hormones. So first we have the pituitary gland. The pituitary gland is a very important gland because it is actually what we call the master gland, because the pituitary gland is the one that stimulates the other glands of the body to produce the hormones. So which means to say that if there is damage to the pituitary gland, the other glands of the body will not be able to produce the hormones. And also your pituitary gland secrete what you call the stimulating hormones. Hormones that stimulate the other glands of the body to produce the hormones, is what I have said, like your thyroid gland, like your ovaries and your testes, and your adrenal glands as well. So the pituitary gland actually has a lot of hormones, because your pituitary gland is divided into two main divisions. You have your posterior pituitary gland and your anterior pituitary gland. In the posterior pituitary gland, you could find the production of the hormone, which is your antidiuretic hormone, and also oxytocin. For the anterior pituitary gland, you have the somatotropin, or the growth hormone, prolactin, TSH, ACTH, FSH, and LH, which are all what we call the stimulating hormones, as what I have said, to stimulate the other glands of the body to produce the hormones. Now, the function of ADH, or antidiuretic hormone, is for the reabsorption of water. So it tells the kidney to reabsorb the water so that it leads to water retention. And ADH has a very important role specifically for situations like hypovolemic shock, wherein there is a need for the body to raise the blood pressure, and that is by retaining the fluid. So your antidiuretic hormone is for the reabsorption of water. And you also know that if there is a lack of ADH, it leads to a condition known as diabetes insipidus, which is characterized by excessive urination. Now, oxytocin is a hormone that is being released to stimulate uterine contraction, and this one has a very big significance for women who are, or for mothers after labor and delivery. Somatotropin is also known as your growth hormone, and this is the hormone that stimulates bone and muscle growth. If there is too much production of somatotropin, a disorder that results from that condition is called acromegaly. Prolactin is a hormone that is really very important for the production and secretion of milk after childbirth. And TSH, ACTH, FSH, and LH are all hormones that we call stimulating hormones. So their function is to stimulate the production of the hormones of the other organs. So for example, your TSH, the function of this is to stimulate the production of thyroid hormones. ACTH is to stimulate the production of hormones from the adrenal cortex. And FSH and LH are hormones very important for ovulation and the secretion of sex hormones in both genders. And what are those sex hormones? We have the estrogen, progesterone, and your testosterone. The pineal gland is a fairly unpopular gland of the body, but it's a gland that produces melatonin. And if you can remember, melatonin is even a medication nowadays wherein it's being used to promote sleep among patients. So the purpose of the pineal gland, or the melatonin rather, is to balance the circadian rhythm, to regulate that, and also for sleep cycle. And melatonin is usually produced when the environment is darker. So in a dark environment, it stimulates the brain to release the melatonin. The next gland is going to be your thyroid gland. The thyroid gland secretes two hormones, which are your T4 and T3, and an additional one actually, which is your calcitonin. Your T4 and T3, the other name for T4 is your tetraiodothyronine, and T3 is triiodothyronine. So T3 and T4 are hormones that regulate the metabolic rate of the body. And the related disorder when there is a lack of production of T4 and T3 is hypothyroidism. And if there's too much production of T3 and T4, that leads to hyperthyroidism. Calcitonin is a hormone that's being released by the thyroid gland to decrease the calcium level in the blood. The parathyroid glands, which are found adjacent to the thyroid glands, secrete the hormone called parathormone. And parathormone increases the calcium in the blood. So this is very important to remember. The antagonistic actions or effects of both of these hormones, the calcitonin and parathormone. Calcitonin is to decrease the calcium level in the blood, while your parathormone is to increase the calcium level in the blood. So you have to understand that when there is an increase in the parathormone production, then definitely that leads to an increased calcium level. And with increased calcium level, that deprives the bones of storage of calcium, and that would lead to fracture. The adrenal glands, which are found on top of the kidney, has two main structures. You have the cortex and you have the medulla. So let's first discuss the cortex. The cortex has three main hormones that are being produced: your glucocorticoids, your mineralocorticoids, and you have your androgens. Your glucocorticoids, or otherwise the most popular glucocorticoid, is your cortisol, the function of which is to regulate the blood glucose, fight stress and inflammation. So it's really very important to understand the role of cortisol in the body, because a patient who doesn't have enough cortisol will be unable to fight stress and will be unable to fight inflammation. And at the same time, a lack of glucocorticoid can also result into hypoglycemia. So associated conditions related to the dysfunction of the adrenal gland will be a condition known as Addison's disease and Cushing syndrome. So Addison's disease is a disease characterized by the lack of all the hormones being produced by the adrenal cortex. And Cushing syndrome is a condition that is characterized by an increase in the production of the hormones found in the adrenal cortex. Now, your mineralocorticoids, the number one or the most principal mineralocorticoid is your aldosterone. So the role of the aldosterone in the body is to regulate your sodium reabsorption, the water and potassium excretion by the kidney as well. So you have to remember that when aldosterone is released, the sodium level in the body will increase while potassium level will decrease, because sodium will be retained while the kidney will be releasing the potassium. Another one would be the hormones called androgens. Androgens, which are only trace sex hormones found in the adrenal glands, because you will find out also later on that your other androgens will be produced in your ovaries or testes. So the androgens promote the development of secondary sexual characteristics. The other part of the adrenal gland that we're going to discuss is the medulla. The medulla secretes your epinephrine and norepinephrine, which are called your catecholamines, and they are associated with the fight or flight response, which is the body's mechanism to adapt to stress. The next gland that we're going to discuss will be your pancreas. So the pancreas has two types of cells that produce hormones. You have the alpha cells and you have the beta cells. The alpha cells secrete your glucagon, which elevates the blood glucose level, and the beta cells secrete your insulin, which reduces the blood glucose level. So you could see the antagonistic relationship between your glucagon and insulin. So glucagon, when released, will elevate your blood sugar, while your insulin, when released, will reduce your blood sugar. The last two hormones that we're going to discuss will be your ovaries and testes. Your ovaries secrete the hormone estrogen and progesterone, and the purpose of which is to develop and maintain the female sex organs. Your testes produce what you call the androgens, and the primary androgen is your testosterone. And the purpose of testosterone also is to develop and maintain the male sex organs. So this is it, everyone, the overall presentation of the endocrine system. I hope that this is a quick but a very meaningful discussion about the endocrine system. Now, my NCLEX tip to everyone is to make sure that you really remember or understand the functions of the endocrine system, because that will help you also understand the associated disorders. So later on, if you study disorders like hypothyroidism and hyperthyroidism, your acromegaly and Siemens disease, your hypothyroidism and hyperparathyroidism, for example, your Cushing syndrome versus Addison's disease. So when you're looking at all of these disorders, you have to go back to the functions of the hormones so that you will understand what's really going on with the patient. So thank you very much, everyone. If you like my presentation, please share it with your friends. Like my YouTube page also, or subscribe to my channels. And also, you could visit my website, which is www.matusnursingreview.com. Thank you very much, everyone.